Hello, everyone, and welcome to our COVID-19 vaccine Truman Medical Center's University Health Town Hall. I'm Nikki Lee Donowa, Chief Community Relations Officer here at Truman Medical Centers. And in today's town hall, we will discuss questions posed by some of our faith-based community partners, as well as community members in general. And we know that due to health disparities and lack of healthcare access, numerous pre-existing conditions are experienced by our Black and Brown people, and this virus has had a disproportionate effect on our communities. That, coupled with the challenge of economic situations and lack of health insurance, many times leaves family members having to choose between food, lights, transportation, and healthcare. So as a safety net hospital, we're here to provide great care, health education, and make it as accessible as possible for everyone, regardless of your economic status. So today we have two of our very highly esteemed physicians here at TMC University Health with us, Dr. Moncure. Dr. Moncure is a trauma surgeon and critical care specialist, Vice Chairman, Department of Surgery at TMC UH, Professor at UMKC School of Medicine, and Coffey Endowed Chair of Surgery at UMKC School of Medicine. Dr. Tracy Johnson is an OBGYN Maternal Fetal Medicine Fellow, and she is joining us today. And one of the best, I might add, in the city. We also have Carrie Benshoof, Director of Patient Access Services. We have another esteemed guest with us today, Reverend Modest Miles, the pastor of Morning Star Baptist Church. And we asked Reverend Miles to join us because we wanted him to hear it straight from the horse's mouth. And he's been an awesome community partner for us. So let's jump right into some questions. Dr. Johnson, I'll start with you. What is the difference between Pfizer, Moderna, AstraZeneca, and I'm also hearing that Johnson & Johnson is coming out with the vaccine as well?
So the wonderful thing about these vaccines is that what they've done is used old technology that we hadn't really used in a large way in the past. They were thinking about different ways to use this technology with cancer treatments and other disease processes, but they hadn't really used it. And so whenever things happened in China, they said, there's no way we're gonna have a 5-year time length 5-year time span in order to make a vaccine that's going to get to the world. So they started to look at new and innovative ways to help a large amount of people, but be able to reproduce it in a way that all different countries could benefit, all different types of patients could benefit. And what they found was there was this new technology using mRNA, which sounds very, very confusing to a lot of people in different backgrounds. But basically what they're doing is teaching your body how to make a protein that looks like the virus but doesn't have the virus. And so then your body can realize what the virus looks like without having to see the virus. And so I explain it to my family that way because it seems really kind of like sci-fi and it's weird cookbook stuff where people are experimenting on us, but that's actually not what it is. It's a technology that's been used a long time ago, but not in vaccines. Our current vaccines, the flu vaccine, the Tdap vaccine that you get when you're pregnant. People have gotten pneumonia vaccines, meningitis vaccines, the HPV vaccine that we want you to give your daughters and your sons when they're becoming 12, 13, 14 years old. These are vaccines that we do all the time. And those are technologies that are kind of a little bit outdated in some ways, but they actually use virus. They use bacterial pieces. They use things like that we let people inject into our body, teaches your body what it looks like because it's actually part of the virus. And then our body reacts to that in a way that when it sees it again, you're actually going to fight it off really quickly. There's even things like the tetanus that I mentioned that looks at the toxin that the tetanus has, so that your body, when it sees it, it will kill it. This vaccine doesn't actually use any virus, although it's really, really scary. It makes you think, oh my gosh, you're going to put that virus in me that's killing somebody else. Why in the world would I let you do that? I get that, but that's not what it's doing. It's really, really smart. It's taking the actual coding mechanism. So if I break it down in a way that I explain it to my family, sometimes we need the playbook that actually tells you what things look like and how to run, jump, and play. That playbook that also tells you what your hair is going to look like and everything else, there's a way to take the actual code and teach it to your body cells. And then that actual code tells your body cells what the virus actually looks like, the outside of the virus. So then your body says, if you see any kind of virus like that, you kill it dead. And so that's what happened, is they used that technique. And that's what the Pfizer, Moderna, and others have used. The other reason why it's beneficial is because when we don't have to actually use pieces of the virus, bacteria, or toxin, you don't have to have any live virus, bacteria, or toxin. So the old vaccines take a really long time to make. And they take that long because you have to grow up the bacteria, virus, or toxin, then change it in a way that you can put it into and package it in a way to give it to a patient in a vaccine. This type of technology is just teaching your body the code, and you don't have to grow any of the virus. They also can change it enough that if they do find in a year that the virus has changed so much that we need to change it, they can modify it a little bit and still make a lot of vaccine. So what they've done is take all the lessons we've learned, Nikki, over like, I don't know how many years, and they've put all that information into making these vaccines in a really, really, really fast way. The last thing, if you'll let me, Nikki, say is that people also were really, really worried about the fact that they made the vaccine so fast that it must not be very good. And what I've told my family is, normally with the FDA and other things, it does take a long time. One, because you got to grow the virus, bacteria, or toxin. You have to repackage it. You have to test it and make sure it's safe. The way I appreciate what happened with the FDA is that because COVID was such a big deal and because it's hurt so many people and taken so many lives, they put special teams in place that all they did was wait for COVID stuff to come in, process it, and move it to the next step. People were working day and night, day and night, day and night, so that when it normally takes you at your office, you get 10 emails, you sort through them, you order them in the way that they go. You might push one off for a week. You might push one off for 2 weeks because you got something else. These people, all they did all day was work on COVID, day, night. So it's shortened a lot of that lag time, which is wonderful. Does that make sense?
Absolutely. I like the way you break that down. Makes a lot of sense. And so knowing that we've got two pharmaceutical companies that have vaccines out now, one of the questions was, will healthcare workers and wealthy people get better vaccines than the general public?
Dr. Moncure, you want to answer that one?
Yeah, so there are two different vaccines that are out right now. One requires intense refrigeration, and that's the Pfizer, and the other one doesn't require a lot of heroics to store it. And there are right now, the federal government has mandated that all states dictate how they're gonna give out the vaccine. Obviously I live here in Missouri, and I'm part of a committee that looks at disaster planning, MARC, and that also is a community agency that partners with hospitals, and I'm on different groups that also have the charge to how it's going to be administered. The CDC, the national organization, basically comes up with what they think is the most logical way to administer the vaccine, and they've already spoken. And they said that healthcare workers that are frontline should get the vaccine first. Then at the same time, we should be creating a mechanism so that people in nursing homes and people that work in nursing homes will also get the vaccine during this first go round. And the next go round, it hasn't been fully dictated, but it's probably going to be, again, essential workers and people on the front line, such as police, fire, EMS, and then it's going to go in different waves. There are states that are different. I'm happy to say that Missouri and Kansas have kind of taken what the CDC has said, and they've done it. If you watch the news, Florida has taken a different tack. Another high impact group is over the age of 75. They elected to not administer they elected to allow counties to dictate, and they also have said that anyone above the age of 65 should get the virus, and it's first come, first serve. So
it's not going to be any different
exactly.
for if you're rich, you're poor, you black, you're white. Everybody's going to get the same quality of vaccine, is what I think I hear you saying.
It's going to be the same. It's going to be the same vaccine, and it's just where and when you'll be allowed to get it. And so there are people being called out, and it's very small incidences of individuals trying to supposedly jump the line. And but I think they've held true to the mission in Kansas and Missouri thus far, and that they deem which group should get it first, and that's how it's administered. It's not who's the most powerful, who has the most money. Do you get a double dose if you're rich, and you get a single dose if you're poor? It's the same allotment, and so we've been trying to make sure that it's fair.
And Nikki, the other thing I'll add is people also have asked, I don't want to get Moderna if my doctor got Pfizer. Like Dr. Moncure said, the reason why we get Pfizer more likely, we might get Moderna too, but the reason why the docs are getting and the physicians and everyone is getting the Pfizer more likely is, like he said, Pfizer requires intense refrigeration. Big corporations are able to have those processes in place where they can keep it really cold. Also, the Pfizer only allows you to buy it in bulk of like 900 something, 1,000 vials. And so a small place that has 300 employees can't buy Pfizer, because then they have 600 vials that they don't know what to do with, and they're not going to let you waste any vaccine. So they might get the Moderna, which lets you buy it in bulk of like 10, I think, something really small. Okay. So for that reason, they'll let you get the Moderna more easier. So if you work in a small company or you only need to get a 300, you're going to buy the Moderna so you don't waste any. So that's more likely why people in the community are more likely to get Moderna, and people in hospital systems are more likely to get Pfizer. I know in St. Louis, there was a hospital that bought too much Pfizer, and they scurried to get that offloaded to different places so that they didn't have to waste it. And that's something that they want to prevent. So no, we get the same thing you get. It has the same efficacy, 94.1 and 95%. They're the same.
Okay, that's good news. So now, as an African American, we haven't forgot about the whole Tuskegee experiments, where Black people were thought they were being treated for syphilis, but it was a placebo. And so many people suffered for many years behind that. So for those people that are saying, I'm thinking about waiting. I just want to wait and see what happens to everybody else, because this might be a little bit like Tuskegee. Why isn't that a good idea, Dr. Johnson? Why shouldn't they wait?
So I don't know how to say it without being a little bit emotional, but as an African-American person, not even just a doc, but a person, we're not the same as everybody else. As a person of color, we're not the same as everybody else. And you might say that that's good, bad, ugly, whatever it is to you. COVID affects us differently. We don't know why. It'll take years to figure that out. But I will tell you this. If you are not a person of color or a person of diverse background, there's not really a big quote of how much this has affected that population. People that are older, yes. People that have certain medical problems, yes. But I can tell you, with no other things put on it, 1 in 800 African Americans, not African Americans who are overweight, not African Americans who live in Atlanta, not African Americans who drive a red car. I mean, 1 in 800. I know 800. Nikki, I know you know 800 Black people. Dr. Moncure knows probably five times that. 1 in 800 has died from COVID. Not gotten it and had a cold and been sick, not in the hospital, they died. They lost their life. They're no longer living. Their family does not get to celebrate them at the table during Thanksgiving anymore. 1 in 800 died. And so for some reason, it's affected us in a way that we cannot fight it off like we should. We should be first trying to get the vaccine because it affects us more severely than it affects other people.
Yeah.
Now, we can't jump the line. We shouldn't jump the line, but we need to make sure we get it. And what our fear is that because of fear, because of what we've done in the past to people of diverse backgrounds in this country, we're not going to get it. And then we're going to still be dying. My grandmother said it best. She said, I feel like we're just going to allow ourselves to die, Tracy, because now we have an actual treatment that can help us. And then we're so scared everyone else is going to stop getting sick and die. And we're going to still be dying. And that's what my grandmother said. Like, that's really what we're talking about, people that look like me, people that don't. If you have someone that offers you the vaccine, you need to go get it because we will still be dying while everyone is getting better. That's literally what we're talking about.
There's no way I can
Yeah.
more profound than grandma because she's wise. That's wisdom, and she's right. And there's no doubt that science has not treated us well. I mean, science has let us down as a people, and people of color all the way through. Throughout history. But we could say that having diversity and having people within the science community that are helping to run these studies, to help to analyze the data, that are in medicine to critically look at the data to make sure we're not doing anything. There's no way that Dr. Johnson and I would be on this phone call and being proponents of this if we thought there was any way that this was some sort of plot or this was disproportionately going to be more harmful for people of color, Black people. And so we're here because this is our chance to, if you get the opportunity to get the vaccine, you've got to take the opportunity. Do not wait because there are only so many allotments of this vaccine.
Right.
I know of only a few people that are kind of waiting and they want to see what happens or what have you. They might be out of luck because when it moves to one distribution and moves to another, there's not going to be some big surplus of vaccine left. And so we've got to take advantage. And if you look at this, and I've kind of said this before, it's almost like a perfect storm as far as the disease. If you were going to sit down, it's the disease that's the problem, the thing that we need to be afraid of. If you were looking at a perfect storm, you look at something that if it affected you and if you had any kind of medical problems or you didn't have access to get to healthcare, though really high-level healthcare, or if you had some thoughts in your mind, I'm just going to wait at home and wait this disease out to see if I get better. That's what happens. Our people don't have insurance. They're because of COVID and the economy, they're out of jobs, they're out of insurance, and they're afraid they're going to be bankrupt. The longer you wait on this disease process, the worse you are and the less likely that people within healthcare are going to be able to help you. So why not do the best thing is prevent getting the disease?
Amen.
I hear you. It's 2021. I know we don't forget, but at this point, we got to move on and trust the science today. So
absolutely.
So Dr. Moncure, I thought that once you get COVID-19, your body creates these antibodies. So isn't that kind of like taking the vaccine already, or how long does that immunity last?
This is a unique disease process from the standpoint that we are hearing scattering reports of individuals getting it a second time and maybe even a third time. We know that probably your antibodies that you develop to the disease may protect you as much as 3 months. Nobody's willing to vouch for any longer than that. And so you're going to be again prone to the disease. If you, I can't explain the whole process any better than Dr. Johnson did earlier in regards to those triggering proteins and having your antibodies that are triggered to, that are pointed to those trigger proteins in the virus, so that when the virus enters your body, it helps to fight it. And so, and therefore, if you're hearing about all these different mutations that are occurring,
Yeah.
but so far, it's because we're not just that specific virus, but we're talking about a key component of that virus that we still are able to fight the disease. So do not count on the fact that you've had COVID as a means of protecting you in the future. That is not, doesn't make sense. The science is not there. And I think some people might take cues from our president, who's not taken the vaccine yet because he had COVID, in October or whatever. But bottom line, he's prone to getting COVID again.
Okay. Well, you mentioned something there about those mutations. So, Dr. Johnson, so we got a new strain of coronavirus out there. We might have some more. So if I get the vaccine, now, is that going to protect me from those new strains that are coming along?
Well, let me just have a big disclaimer. I'll cover Dr. Moncure with this too. While you want me to say that I know everything about COVID, I'm going to tell you 100% that we don't, because we still have to keep on learning about it. I will tell you that what we know so far is that every time there's a positive test, the CDC and other large organizations all around the world have some way of tracking different pieces of specimens, so they can find out that, Nikki, I'm not gonna put that on you. If somebody's positive soon, then they can go and get that sample, not necessarily like looking at your cells, but they get a piece of that viral sample and they can tell if that viral sample looks the same as the one in Atlanta, looks the same in California. So they've been monitoring this thing for a long time, and we wanted them to, right? They needed to know what we're dealing with. In doing so, that's how they can tell when in South Africa, in the UK, in various places, it looks a little different. And what they've seen is this thing is mutated probably 150,000 times is the latest number I heard. In that, you might go, well, what's the whole point? Why in the world are we even doing a vaccine? These people are geniuses, these scientists. What they've done is they realize that the thing that's been the most stable is that spike protein. And that spike protein is latching onto a part of your cells, really in the lungs and other parts of your body. And that's how it gets in and it goes crazy. Well, that spike protein is mutated. It has, but not in such a way that we don't recognize it when we taught it with the vaccine what it looks like. So that's what's happened is, as long as that thing doesn't completely change, which it just hasn't over 150,000 mutations. It hasn't changed that much. And I will tell you, the thing that's really, really encouraging to me is that even when it is changing a little, because they said the recent variant in South Africa has changed 8 times or something like that, whereas normally there's like 1 or 2 mutations. Even then, we still think it's covering that because it still should recognize it. But also, even if it doesn't, they can change the vaccine just enough with the next batch to make sure. So that may make you go, well, I'm gonna wait. No, you shouldn't, because they're pretty sure that it's gonna cover almost all the different strains.
Okay, that's
And
good.
just to add, Nikki, I would just say what Dr. Johnson said, 100% true. I would also say there's even more reason to do all the mitigation, things that will prevent you from getting the disease.
Okay.
Because obviously, the more people that get the disease, the more chances for mutations, the more chances that we could get off track. And so, and with this more easily transmissible, form of COVID, that just means you're more apt. If you don't take the protections, you don't wear face masks, you don't social distancing, you don't do the things now, don't go to super spreader events. If you don't do those things, then it's going to be easier for you to get the virus. And therefore, if you haven't gotten the vaccine yet, you could be at risk of dying. You could be part of that 1 in 800. So please be careful.
So, all right. So now I'm hearing that we know there's 2 doses that you're going to take of this vaccine. But I guess maybe we could run out, or maybe we could get more people vaccinated if we only did one dose. So where do we stand on that? Is it one dose? Can we get by with just one dose? Do we need both doses of the vaccine?
So the bottom line, the science was done on 2 doses. And so even if they empty the storehouses and they administer 1 dose to folks, the plan should be, and I think it will be, that a second dose will be given. But there is some data, but it hasn't been studied. And we as scientists can't say that, oh, it'll probably work, or it'll probably be okay. It's going to be, scrutinized before. And I trust the scientists that are experts at the CDC and National Infectious Disease Unit, Dr. Fauci, and some of those individuals. If that becomes a strategy, then it should be evidence-based. But I think the thought is that getting as much out as quickly as possible is probably the most logical. I think the fear is that if we hold back half the doses for individuals and to reserve a second dose, that there are going to be that other half that could have been vaccinated that may be at risk. So stay tuned.
Okay, so now, all right, that's Dr. Johnson. So I'm after I get my second dose, I can drop the mask, I can go out and kick it. I'm good, right?
No, that's a really good question, Nikki. So what I've heard, and again, I would love for Dr. Fauci to tell us if this is true, but I've heard 75% prevention of getting a severe COVID infection after the first dose, 94 and 95% with Pfizer and Moderna, 48 hours after, no, 14 days after the second dose.
Okay.
After the second dose of Pfizer or Moderna is what I've heard the stats. So 94 and 95% is not 100%. And it's not ever getting infected. It's the severe infection. It's kind of like some of the other things that we're trying to prevent. We just don't want you to die. COVID's out there. You can see on all the statistics and everything else that it is out there. Just, we don't want you to get sick and die. If you get it, we want it to be a small cold and you keep it moving. So don't play the odds. That's why I don't play the lottery, Nikki. I just don't play the lottery because I'm not going to win.
Yeah, I got to get some in exchange for my money, at least a pair of shoes or something.
Right?
Right? Okay, now, Carrie, I am glad you're here because this is to you. So is there a cost associated with the vaccine? Any kind of fee that we'll have to pay when we get the vaccine?
So the current vaccines have been purchased with tax dollars and will be given to American people at no cost. However, the vaccination providers will be able to charge an administrative fee for giving the shot to someone. But if you have public or private health insurance, those providers will be billing your insurance. And if you're uninsured, there is funding available through the HRSA Provider Relief Fund. So in essence, what this means for you is that whether you have insurance or whether you're uninsured, you will not be billed for the vaccine. Although there is a charge that's associated with it, you personally will not be billed for the vaccine.
Okay, so I don't have to come in tow with any money. You're just
No.
submit that to my insurance company if I have insurance, and if I don't have insurance, you're going to find someone that's going to cover me still, right?
Absolutely correct.
Awesome. Okay. All
Nikki,
right.
can I say one thing?
Yes.
I mean, if there's any benefit to, which obviously this is a travesty, this whole pandemic. Now, one of the things I've noticed in sitting on these different committees that look at triaging and portioning care, whether it be the vaccine, whether it be testing, whether it be new treatment regimens, a lot of people in our ethics environment are heavily involved, and they're trying to make sure that nothing unfair happens in regards to any of these treatments. And one of the things that's come out as far as triage and looking at people that are disadvantaged from a financial and health standpoint, is that you'll probably see that maybe they may use zip codes, or they may use places within the city that are incredibly disadvantaged to actually push people forward in that realm. And there are a lot of people that are speaking up that have heavy voices to make sure things are fair. I don't know that during my lifetime that's ever been a huge impetus of what we've done. But I think, again, it just shows that the more people we have around the table of different backgrounds and different ethnicities, whatever, then you're going to have more fairness.
Yes, and I am glad we have a seat at the table at this day and age. So now either one of you might be able to answer this or speak to this one. Do you know of anyone that has hypertension or diabetes that's taken the vaccine and had adverse, effects? And I mean, this is kind of a fair question because so many of the Black and brown population have, hypertension or diabetes, high blood pressure, or sugar, as my grandmother would call it.
I'll just say I personally have hypertension, and I completed my series maybe 5 days ago. I got my second dose, and I want to be very clear when we talk about side effects. So a side effect of a vaccine is always going to be some local irritation, maybe a bruise. You get your little cute little Band-Aid. You can walk around with your little Band-Aid on. And then you might have a low-grade fever. This is typical, like flu vaccine, other vaccines. You might have maybe some soreness. You might have feeling like you're just a little bit tired. You may feel a headache every once in a while. With the old vaccines, if you have like an egg allergy, things like that, people ask you about it. Okay, those are side effects. Now, when we talk about the COVID vaccine, people start to get real upset and go, oh, it's going to kill me. Oh, it's going to do all these things. The side effects are horrible. I will tell you, with the new technology, the side effects are a little bit more noticeable, I found. And some of that may just be because I was really paying attention. I don't think so, but I can't say for sure. But with the first vaccine, yeah, I was a little bit more tired. I had a little bit more of a headache, which I have migraines in general. And then I did have more arm soreness than I normally have. Now, why is that? It's a medication that's sole purpose is to rev up your immune system. Why is that? Because it's trying to teach your immune system how to pick up a new bug. And so with the way that they did it, they packaged it in oil, and in the oil, it goes in your body and is absorbed, and then your immune system incorporates the code, the teaching code. So yeah, you're gonna feel that, and it's not this horrible, I'm in the hospital. It really isn't. It's Black people, we get real scared when it comes to stuff like that. I'll just say, I feel like we do at least. And with the second vaccine, my symptoms were more severe. They weren't horrible. They didn't put me in the hospital. I had a fever. I did. And I had a headache, but I'm not going to get COVID most likely.
You just take a couple of Tylenol.
You take some Tylenol and you keep it moving. My sister in particular is, she keeps asking me about the side effects. But what about the side effects? Honey, but what about COVID?
Yeah.
I know somebody that they lost 5 people in their family to COVID. 5. And not just 5, but they didn't get to have a funeral. So you know what, those side effects, you'll get over them, because you know what, they go away in 2 days. But being gone from COVID because you died doesn't go away in 2 days. What do you think, Dr. Moncure?
I would completely agree. I have hypertension, and I had probably the minor symptoms. I'll get my second dose tomorrow. And so I'm just going in mentally prepared for that. And you're absolutely right. I think we're more focused on this than on anything else because of just, I think this last couple years is particularly this last year has probably been wearing on us, because I think that's why people advocate that. And I'm so happy for these forums that we tell people the truth, tell them 100%. And what to expect, and then there's not going to be so much speculation and so much conjuring up conspiracies and everything else. I watched the video. I had a cousin that sent me a video from a scientist who's Black who talked about the spike proteins, and that that Black people have more spike proteins than other people, and so they're going to get the dose and then they're just going to fall out and basically die or whatever.
Oh.
Obviously, that has not happened. Yeah, and we've got to be very careful with that, because there's lots of things that you could talk about as far as theoretical and what have you, but the data has not shown that. And I have all friends across the country in healthcare, as Dr. Johnson, I'm sure she does as well. And I've not known anyone to have more than the headache, maybe low-grade fever, sore arm, and that's about it. And they're usually up and running within 2 to 3 days for sure. But probably just work through all the symptoms.
Dose
They're
of my
not that
fever,
severe.
I had to take some Tylenol for that fever. I mean, I could tell. Oh yeah, I'm tired. I'm not feeling good. But again, it was like it wasn't like I was dying. I took some Tylenol. Like it, you've been sick with the cold. It's not that big of a deal. And the other thing I was telling my husband is, thank God my immune system works. Like I could tell it was doing stuff. That's good. I mean, I was just like, oh my gosh, COVID ain't gonna stand a chance when it sees me. I'm not gonna stand a chance. Because I felt my body. I was like, yes. And I know Black people, I know right now, if they're watching, they're going, well, I don't want to feel that. Oh yeah, you do. That vaccine. Oh, wait till COVID thinks it's gonna get me. My body is gonna kill it. I'm so happy.
All right, I'll take a little fever and I'll take a couple of Tylenol. I can deal with that. I do not want to be in the hospital on a ventilator.
That's exactly right.
Okay, so now I'm hearing this. People said that I might get HIV if I get the vaccine. Can I get HIV from the vaccine?
No, it doesn't have anything in it. So I'll change that question a little bit, Nikki. People think that they could get a lot of stuff from that vaccine because I think they think other things are in it, Nikki.
Mm-hmm.
So yeah, the old vaccines, they had a little bit of egg protein because they made them in egg. They grew up the flu vaccine in eggs, and they incubated it and killed a little bit of the virus, the flu virus, and then they pulled that off and put it in the flu vaccine. Yeah, I see how you think that you can put other things in it, but they didn't do that with the COVID vaccine. They didn't do that because it has to be usable for the whole world. It didn't have anything extra in it. There are people with all sorts of dietary things all over the world. There are people with different resources that we have in different parts of the world where they don't have access to the chickens to make the eggs or any of the things that we have. So it is just straight science. It only has oil. I think it has a little bit of sugar, and then it has the mRNA. Like if you look it up, I think there's like 6 things in it, and it's like 2 different kinds of sugar, oil, and the mRNA. Like they strip that thing of everything. Now, yeah, you're probably thinking what I'm thinking. Oh, why didn't they do that with the other vaccines? Yeah, they probably will now, because when we know better, we do better. But they didn't. But with this one, they got it right. They took everything out of it. So you can't get HIV if HIV is not in there. It's not in there. It's in a little vial. You can't get, I don't know, an egg allergy if there's no egg in it. There's nothing in it. So I'm reassured. That was the last thing that I was anxious about is, what else is in it? What else can I looked it up. I read all the stuff. I looked at Dr. Fauci's stuff. I looked at there's nothing else in it. So that was my last little check to say, yep, I'm getting it. I'm going to take it.
Okay, fair enough. So now so people are on medications if they have hypertension, diabetes, or whatever. Are there any medications or supplements that you think will interfere with or have a bad interaction because you're on those meds from the vaccine? Or
what do you think, Dr. Moncure? I don't know any. They just want you to not take a lot of ibuprofen so that you don't blunt your immune response.
Right.
But they don't know that that's going to hurt it. They just recommend you not do it.
Okay.
Right.
A lot of people are making sure they get their vitamin D in every day, and so that's okay.
I don't know about any
okay.
of that
None of
stuff.
that
I think you just keep doing what you're doing, right, Dr. Moncure?
I would agree. And vitamin D can be helpful as far as if you were to get the virus itself. But yeah,
Right.
I would agree. Keep doing what you're doing as long as it doesn't interfere. I think it's been consistent that ibuprofen is not good if you do contract a disease. And so therefore avoiding it and just using Tylenol, would probably be a recommended way to go.
Okay, okay. All right, so now Carrie, so when I go to get my vaccine, I'm being told I gotta wait for 15 minutes to make sure I don't have some adverse effect. But now let's say, God forbid, I did. And so I'm assuming that I'll be treated at Truman. And will I be responsible for the bill if I get treated?
Well, I just want to say first, I think that's one of the benefits of getting the vaccine here at Truman is that if in the very unlikely event that something does happen, you're very close to the additional care that you need. So yes, you would be referred into our emergency room, which is very close to where the vaccines are being administered. And yes, we would bill your insurance. If you don't have insurance, that's another great thing about Truman is we have a lot of financial options out there available to patients who are uninsured. But yes, you would in essence be responsible for that at that time.
Okay, okay. Well, that's
Can I just say also, Nikki, that
Mhm.
I so appreciate Truman in the way they are involved in the community and part of the community. That's one of the reasons. And obviously your office is like first and foremost from that standpoint. But I just appreciate the fact that I could tell people, go to the hospital. If you feel like you have to go to the hospital, you shouldn't wait until you know you are so sick that the
Right.
people at Truman are not going to turn you away based on financial need. They're going to do whatever we think is right for you. The treatments that we get at Truman that we administer to our patients are state of the art. And I can tell you from working at ICU, that is for sure the truth. The worst thing you could do is if you were to have a problem, and that's going back to if you were to contract COVID, is
Mhm.
to wait anything out. Go to the emergency room. Have some of the best ER doctors, have some of the best ICU doctors, best nurses on every front. And Carla could tell you
The best
they're going to do the
OBs.
right thing for you.
Best
Yes,
OBGYNs,
that's
thank
given.
you.
That's a given. That's a given.
We're all good here. Thank you, and I do agree
Yeah.
with you. I agree with you 100%. Okay, so I think I've got one more from a community member here that says, should I take the vaccine if I have sickle cell or other health-related issues like that?
Dr. Moncure, can you answer that? And also if you've already had COVID too?
One. Yes. 100%. You should get it if you've got any of those diseases. I've not seen anything to say that this is going to be detrimental to any disease process, but those chronic diseases are probably going to make you more prone to get and also to possibly succumb to or die from COVID if you were to get COVID. If you've had COVID in the past, I think the recommendation is that you wait 90 days before you get the vaccine. Carl, is that still true? Is that what we're utilizing?
So 90 days after you've had COVID, it's okay to get the vaccine at
Yeah.
that point?
Yes, yes.
Okay.
That's the information I've gotten. And again, it kind of goes back to that. We talked about that 3 months. You probably are immune. I don't think anyone knows. All the studies were done on individuals that hadn't had COVID yet. And so this again is a good working definition. I think when you go to your healthcare provider, whoever that might be, they're going to use evidence-based approaches. But I don't know of any disease process that says that it's safe not to get a vaccine and don't get it because it's going to be detrimental to you. Dr. Johnson, are you aware of anything?
I'm actually not. I haven't heard of anything whatsoever that you should not get it.
Well, and to that end, now is more crucial than ever that you have a medical home, because if you have those kind of doubts, call your doctor, see your doctor first. I mean, they should have your health records to know whether there's something in this vaccine that might have an adverse effect on you. So yes, please, if you don't have a medical home, please get one, and you're welcome at Truman Medical Center's University Health. All
If you
right.
end up on my operating room, or if you end up on my trauma table, then by the time you recover, I'm setting you up with a PCP at Truman. And because I think that's so easy, and there's so many good doctors, and there's so many preventive things that you can get. And if you're a female of childbearing age or a female period, I'm gonna get you involved with my OBGYN colleagues, because I don't know any better outfit of individuals that are concerned about you and will take good care of you. It just doesn't make sense not to.
Wonderful. And we don't want to be on your table, but if I had to be on anybody's, I'd want it to be yours. Okay. Okay, so now what I'm hearing also is about this whole distribution plan, and everybody wants to know, when will I be able to get the vaccine? What I know is that we are still in phase 1A. And I think you've probably seen the news, and Health and Human Services now recommends that we're going to expand that whole COVID-19 vaccine, make it accessible to individuals over 65, to help kind of speed up the whole process of getting everybody vaccinated. But just for Truman's sake, we are going to follow state guidelines. We are still going to be in phase 1A. They do seem to be expanding those phases, and maybe it looks like they're merging a little bit. But do stay tuned and visit our website regularly, because you will know exactly where we are, and we will do whatever the state says, and we'll go to the next phase when they say go. Okay. Let's see, one of the other things was, will Truman patients be contacted when it's their turn, or will they just need to show up when it's announced that it's available? Well, I had spoken to our folks here, and they said that the TMC patients will be contacted. So if you're not a patient here at Truman, you can check with your own doctor. You can check with the county websites. You know, they all have a plan for their own county. But if you're a Truman patient, we're going to contact you. Now, in the best case scenario, we've got enough vaccine to go around, whether you're a Truman patient or not. And in that case, you'll see our mobile units out there as soon as we determine the location, the safety of having the vaccine, your safety of being at an off-site location and taking the vaccine, then we'll be there. Okay. Let's see, how will I know when to return for a second dose? Well, after you get the first one, you're going to get your vaccine card. I keep hearing those vaccine cards are like gold right now, because that will be your confirmation that you've had the vaccine. And on that card, you will also have that date of when your second vaccine is to take place. And so keep the card, hang on to the card, and you'll be good. I've got just a couple more myths that I want to address here. One of them, and you kind of spoke to this earlier, Dr. Johnson, will it alter my DNA, or will I get a microchip put in to track me?
Yeah, that's a really great question. I've heard that so many times. I heard that from my family. I heard that from my friends. So the reason why they're saying that is, one, we're not really trusting right now of the government, and that's not a political statement. That's just accurate. Yeah. Second, because we're not really trusting, we're always looking for something around the corner. I will tell you, there's not a possibility that they've put anything in it that can track you. I have a comment about that in a second. Second, is there, what was your first part of the question? I want to make sure I answered.
Alter my DNA?
Going to alter your DNA. So with your DNA, it is scary that mRNA teaches your body the code. But what's interesting is it only lasts 48 hours. Your body breaks down mRNA really quickly. So it's almost like a text that deletes automatically. So the text, you know how some people on their phone have that program that'll automatically delete your text? That's what your body does naturally. So it's only around for a little bit. So it'll teach your body learns the code and then chews up the evidence really, really quickly. So it can incorporate because your body's chewed it up so fast. Okay. Lastly, I find it really interesting that, all of us, even me, have been worried about this microchip situation, but because we're worried about being tracked. But I'll be honest, the way that you're getting tracked in this world is your phone.
Right? I think they already know where we are. And
I'm just gonna leave that there. This is how they're tracking you. They can't put something in your body. It's your phone, friends. It's your phone.
Yes, yes. And
I can't
I
improve on that analogy at all. I can't improve on that.
right. It's true. And if you Google something, I mean, they already know what you're gonna have for dinner, what you like, what you shopped for
Nikki,
yesterday.
it's
And
not in your body, Nikki.
I know, I know, I know. So, and maybe that whole microchip piece came from the fact that there's something that's attached like a barcode to like the vials of the vaccine, and that tracks information about the remaining doses,
Right.
expiry dates, but it does not contain personal information. So
No, that's so that they can count fast all across the country.
nothing to that. Okay. All right, now Reverend Doctor Modest Miles. Okay, now you just heard it from the horse's mouth. Now tell me if you still have some reservations yourself, or are you planning to get the vaccine when it's your turn?
I'm so grateful to you asked that question. I'm waiting for you to give me the vaccine. Plus the fact I've been so excited to listen to all that was said today that I can even tell my coworkers and my friends in the ministry world that we need to tell the people, take the vaccine. We need it.
Okay, that's what we want to hear, because I know that people are still out there wondering, well, should I wait to now, before we depart, I just want to find out if there are any parting words from my esteemed panels, just one fact that you want these people to remember about this vaccine.
How soon?
I don't have my crystal ball, Reverend Miles. And as I mentioned earlier, we are going to follow the state guidelines. So knowing that we're in phase 1A and that we are still vaccinating our healthcare workers, we have started to vaccinate first responders. And as I mentioned earlier, the federal government is talking in terms of rushing that vaccine out, not keeping storage on a lot of it, getting it out so that now we can immediately start doing age 65 and older. Sometimes those guidelines from state to federal vary a little bit. So we'll just continue to follow the state guidelines and check on our website, please, on a regular basis. But again, if you're a patient of Truman, we're going to reach out to you. So I'm hoping I hope it's not too long.
Please don't, because don't forget.
Speculation is the hope is that by summer, we have vaccinated the bulk of the population, because it's not until you get at least 75 to 90, anywhere to 90% of people vaccinated that you really have made a difference, made a impact on this whole pandemic. And if I had to say one thing, I would reiterate, kind of paraphrasing my colleague, Dr. Johnson, in that the risk and the benefit. The risk is that I might have 1 to 3 days of a minor headache and a sore arm, and versus the risk of getting the disease, I might die. I don't think that's a really hard decision to make. Get the vaccine.
Doc, the only thing that I'm saying, I know you're working with the physical health, but we're with the spiritual health. So we need quick, soon, not late.
Yes, sir.
Yes.
Right.
And then what I would add is that frequently in all people in all walks of healthcare, Black and browns are always left behind. No matter what we do, it's just what happens to us. And what I'll say is that I'm a Christian myself, and I prayed for this. We that are of the faith have to know that when we pray for something, I believe that God answers, and I believe that he did answer in a way that I never thought we would ever get like this. And so I strongly feel that we need to not be left in the dust, and we need to not be left behind. And here's an opportunity where we cannot be left behind, but we have to take one step. And, again, not to mix my faith and medicine, but I have to say when we take one step, God takes two. So we have to actually take the step to get the vaccine to save our own people. We can help ourselves if we just try. And we got to overcome our fear, because God's not the author of fear.
Nikki, thank you so much for allowing me to listen and be on so that I can share with others and the faith that we need to go forward. It's best to take it. We've lost so many. In fact, I'm president of our ministers group, and we've lost so many of our ministers that has left because of the COVID.
Right.
So we are asking soon as possible, I will start talking about it so we can do it, make it happen.
That's wonderful. And you have advocates on this end. I will tell you that right now. I've been advocating to make sure that we get our ministers together. I would love to have multiple ministers get their vaccine at the same time. I think it'll be a very impactful message for our faith community. I did put in the request to say, can they become part of essential workers? There's no guarantee of anything that I'm saying, but I want you to know that you have advocates here that are trying to move the needle so that we can get you in line and get you vaccinated.
Kevin, when you're ready, I'll get them together and we'll, make pictures of them taking it.
I got you on speed dial. We'll have people show up. We'll have cameras. We'll be ready. Okay.
Love that. Okay.
Okay. Carrie, did you have any parting words that you wanted to share with the folks today?
I think really we covered everything. Just a quick reminder that there's no, you will not be charged for the vaccine. So if that's something that you're afraid of, you don't need to be worried about that piece of it. So I know that's a small piece compared to everything else we've been talking about today, but it's pretty important, and it's not something that needs to be a concern.
No, absolutely. We won't let that be a barrier. So I want to thank you all for participating in today's town hall, and thanks to our faith-based community partners for all those great questions. We had input from Friendship Baptist Church, St. James AME, Calvary Temple Baptist Church, Morning Star, Concerned Clergy Network, and numerous community members. And to all our viewers and listeners out there, we hope this helps you to make a more informed and educated decision about taking the vaccine when it's your turn. So for more information and updates, visit your county's website, and please keep checking our website as well, www.truemed.org. Check for any updates and information about the COVID-19 vaccine and other resources in support of helping you live a healthier life in 2021. Thank you all.